am Dr. Holly Howitt. I am the Executive Director of Beacon Community Connections. Beacon does a lot of things for the community. Our main service line is community care navigation, and that is non-clinical case management. What that means is that people that are in need of any kind of social service resource, we find out what their need is, we connect them to the resource, we make sure that the resource was effective, and then we also find out if there's any other needs that they have. We're not open to the public. We take referrals from hospitals, from jails, and other local organizations, and then we follow them for about 90 days. In Lafayette, there are a lot of resources for people in need. What was lacking was following through to make sure that those services were exactly what the individual needed. And then oftentimes we see it's not just one problem somebody's having, they're having multiple problems. And so then just staying there with them in that situation and working through all the issues that they have.
There was nobody that addresses social determinants of health. You go to the hospital, you receive services as far as physical health goes, and then you're out the door, and if you go back home and you don't have electricity or stable housing, more than likely you're going to return to the hospital. That's where Beacon Community Connections comes in. We address those social determinants of health to create a holistic care plan.
Part of the issue is that clients don't have the knowledge sometimes. They don't know what's out there. Other times they don't have the confidence to reach out to what might be out there. They think that maybe they won't say the right thing or they won't make the right impression and it's just not going to work out. Again, these are people who've been discouraged by life situations. And so it helps them, I think, to have us speak for them.
They may not even have access to a computer, but a lot of times if they do, it's just overwhelming. You don't know what stuff you need to have ahead of time, and we're there to help put it all into perspective and go through it with them piece by piece.
We will always be grateful to the Blue Cross Blue Shield Foundation of Louisiana for their belief in our idea and funding it so that we could have a proof of concept. The data that came back, the results that we got from this one-year project allowed us to bring that information to local hospitals and other healthcare organizations who are very interested in expanding this program.
It's a good sense of knowing that when our patients are discharged from the hospital, that people are going to follow up with them. And they look forward to that the most, is that it's not just people in the hospital that care about them, but also knowing that people within their own community care about them and want them to succeed.